Thanks for staying with us for TV5 News at 9. A local event is coming to Mid-Michigan this month focusing on brain health. Joining us this morning to tell us more, we have Dr. Rani Abu-Rashed, the CEO and founder of Neurogen Biomarking. Everyone here, though, knows him as Dr. Rani. So we appreciate you being here. We want to start with asking about maybe some common misconceptions about memory loss and Alzheimer's and dementia.
Sure. Thanks for having me, Christine. So I think the first misconception is that you should be scared of this. And what I mean by that is Alzheimer's, I think, is terrifying for families. And many people say, you know, I don't know if I want to know if I have Alzheimer's. The reality is, much like cancer, you need to know as early as possible. The disease whispers for a decade before it screams. And typically you'll come to me as it's screaming. At that point, it's too late for me to do anything meaningful. If I can catch it when it whispers, however, there are things that I can do, whether treatment, clinical trials, lifestyle changes. So it's too important to not know your status.
That's really interesting. It starts with a whisper and ends with a, that's very interesting. Now, and we talk a little bit about why taking charge of memory concerns matters. You know, is this people of all ages? If you have it, runs in the family, and you might see younger patients, how do you gauge?
Yeah, so you know, we built Neurogen Biomarking to, you know, at the highest level of scientific rigor. And so for us right now, it's 40 and over with a family history, a strong family history, or 50 and over with concerns. So if you're concerned and noticing your attention isn't as good as it once was, your focus isn't as good, maybe you're forgetting some words here and there, that's probably a good time to at least be assessed. And with the new technology that we have, it's so meaningful to get this information.
That's interesting.
Yeah.
Are those ever misconceived as maybe ADHD or something?
Oh, absolutely. People give themselves a million excuses. So you'll have people who are working and busy and they have lives and they're maybe 55, they're 60, and they have a busy schedule and they say, oh, I probably didn't sleep enough. That's why I'm not as sharp as I once was. Or oh, I maybe had a glass of wine and that's why. So we give ourselves excuses for these minor things. And the way the disease works is it's so minor that you could do that for a decade or so. And then eventually something big happens. You leave the stove on for 2 days. You forget the name of the road you live on. And someone says, oh, go get checked. And the issue, really, the white space that we filled as Neurogen nationally, and we're launching nationally in 2 weeks, is really, you know, let us figure it out early and get you where you need to be up to 10 years before you otherwise would have ever.
Wow,
Yeah.
That's amazing.
Yeah.
You know, once we do figure this out, how does early detection really of Alzheimer's make a difference in people's lives and the path forward?
Yeah, it's incredible. So you know, if we can understand early what your risks are, and what we do is we check a blood test called p-tau 217. This is an FDA-approved blood test. Recently, you might have heard about it. We assess that, and if that's elevated, it doesn't mean you get to panic. It just means that biologically there's some changes occurring in the brain that long-term can lead to Alzheimer's dementia. Okay, and it's a pretty strong association. So what we're able to do in those patients that are at risk is really get them in, educate them on all the lifestyle things that can really prolong significant worsening, just things like stopping drinking or minimizing smoking or controlling your blood pressure, your diabetes. And then also we can get them on treatment, which only works if you catch it early. The treatments don't work if you come in when it's screaming. And so that's that. And so right now only 8% of people that see a neurologist are eligible for the treatments because they're coming in during the screaming phase. What we did at Neurogen was built the whisper phase. Let's figure it out in the comfort of your home. Our test comes to your house. You don't have to cancel your schedule or change your life. You do a quick blood test. We get it within 7 days, and we sort of get you where you need to be as quickly as possible with board-certified neurologists that know this world very well.
Wow, I was just going to ask if that would work in a doctor's office, but that's even easier, just coming straight to you.
Yeah, you order it online, and it comes to your home. If you're elevated, you do a telehealth visit with our board-certified neurology team, which is really the top notch when it comes to this protein. They educate you, and then they get you deeper into the system. So, for example, if you lived in Saginaw, and our neurologist saw an elevated result, they might educate you and then say, hey, here are a group of neurologists within 15, 20 miles of you that are at the highest level of Alzheimer's care. And they'll guide you in there really 5 to 10 years before you ever would have thought of it. And it really saves your life. I mean, it's incredible. It's so important to do this.
It is. And tell us about the Neurogen Biomarking Capturing Memories Free Community Brain Health event.
Yep. So our full company launches nationally here in the next couple weeks. Part of what we wanted to do was give back to communities that supported us when we were building the company. And so at Insight Medical Center in Flint on Saturday, we're offering 200 people the free Neurogen platform. You come in, you have to go to www.mybrainday.com. We have limited spots. We have 200 spots, and a lot of them are filled. We've got a handful left, so I would go there now and grab one of the spots. And it's a $499 value end to end. But we wanted to give back to, Insight incubated our company. They supported us early on. And so we did one event in Chicago that was amazing last month. We're doing one in Flint, and then we'll do another one in Coldwater, Michigan in mid-July. And those are really the only 3 that we're going to do for free, at least to everybody.
Wow, this is your chance to be brave, and you just face it head on, because there's always solutions there. We appreciate you being here. Remember, you can find more information too about the event he mentioned. Go to WNEM, click on Hot Links at the top of our homepage. We're back in just a moment.